Awoke Derbie. I am a faculty member of Bahar University. I am going to present a manuscript entitled Low Level of Knowledge About Cervical Cancer Among Ethiopian Women. This is a systematic review and meta-analysis. The presentation will have this outline, introduction, methods, result and discussion, and finally I will conclude the main findings. To start with the introduction, as you know, cervical cancer, it is the fourth most frequent cancer among women, and it is the second most common female cancer in the reproductive age group. Every year, over 500,000 women are diagnosed with cervical cancer, and about more than 165,000 die from the disease. Almost 9 out of 10 cervical cancer deaths disproportionately occur in developing countries. Based on the 2018 WHO report, all forms of cell cancers in Ethiopia, new cervical cancer cases and deaths shared about 6,000 and nearly 5,000 respectively. Several evidence shows that knowledge and awareness of cervical cancer among African women in general is very poor, while mortality is, as you know, very high. Women's knowledge of the disease would impact the uptake of cervical cancer prevention activities like avoiding risk factors to get regular screening and vaccination. Hence, there is a need to have compiled data on the women knowledge about cervical cancer as an input for intervention, which is otherwise very limited in Ethiopian context, even though there are some fragmented findings. Therefore, this systematic review was conducted aimed at assessing the overall knowledge of women about the disease in Ethiopian context. When I come to the method section, this is systematic review and meta-analysis was done based on the PRISMA guideline. So the protocol was registered on the Prospero with this registration number. When I come to the eligibility criteria, we have included studies that have observational study design like cross-sectional studies. Participants were women. The setting was in Ethiopian context, articles published in Ethiopia with English language in reputable journals were included for analysis. When I come to the information source and search strategy, systematically we have searched PubMed or Medline, Scopus, and Gray literatures were also searched using a comprehensive search strings. The last search was done on 21 September 2020. Mesh terms combined with different balloon operator like the or and end were combined. When we come to the study selection, articles imported and handled using the EndNote X5, and after removing the duplicates, the title, the abstract, and the full title text was screened for final inclusion. When I come to the data collection process and data items, among the included study papers, the name of the first author of the article, publication year, mean or median age of the study participants, sample size, variables related to the knowledge of the study subjects about cervical cancer were directly extracted from the papers. 2 authors were involved in selection, data extraction, and measurement of the risk of bias. When we see the meteorological quality appraisal of the included studies, the validity and meteorological quality of all included studies were assessed using the JBI critical appraisal checklist for systematic review. The tool consists of 8 criteria that were checked as yes, no, unclear, or not applicable. The studies were classified into 3 groups. A study that fulfilled greater than 80% of the criteria was considered as good quality. 50 to 80% and less than 50% were rated as fair and poor quality, respectively. Fortunately, all the included studies in this particular review scored greater than 80%, and they were judged meteorologically as good quality. When I come to the data analysis, we have used Microsoft Excel spreadsheet. Descriptive statistics was used to summarize the major findings. To pull the overall knowledge of the women about cervical cancer, meta-analysis was performed using Stata version 14 with a random effect model. The heterogeneity of the included studies was assessed using the I-square test, and I-square greater than or equal to 50% considered as highly heterogeneous among the results of the included studies. When I come to the result in the discussion, among the searched databases like the PubMed, Scopus, and the manual search, totally we have found 116 papers, and among these, finally we have included 26 studies that fulfill our inclusion criteria for analysis. Therefore, this particular systematic review and meta-analysis was based on the findings or the pooled findings of 26 articles. When I come to the characteristic of the included studies, this review contains reports of about 14,549 study participants. The studies were published in the period of 2013 and 2020. Most of the studies were reported from the 4 regions of the country, like Tigray, Amhara, Oromia, and southern nations and nationalities. Actually, 2 articles from Addis Ababa and 1 article was also found from Sidama regional state, the new region. The number of participants in each included study varied from 154 up to 1,186. The mean age of the participants reported by the included studies ranged between 20.5 up to 38 years. The majority of the participants were married and had no formal education. When I come to the knowledge of women on cervical cancer, just you can see, as you see from the table, some of the pooled estimates of or some of the selected variables on cervical cancer knowledge. For example, about 56% of the participants heard about cervical cancer, only 21% know about HPV as the main cause of cervical cancer. About half of the participants identified at least one risk factor for cervical cancer. About 43% identified at least one symptoms of cervical cancer. 46% of the participants believed that cervical cancer is treatable, and more than 50% identified at least one treatment option for cervical cancer. And roughly 40% of the participants ever heard of cervical cancer screening. So this figure in general implies that there is a relatively low information about cervical cancer among Ethiopian women. Therefore, there is an urgent need for government and non-government organizations, including healthcare providers and other stakeholders, to join hands together to educate women, create massive social awareness to reduce the risk of having cervical cancer in the community. When we see the overall knowledge about cervical cancer, the pooled overall knowledge that's reported from the included studies, the reported good knowledge level of the participants were about range between 20 up to 82%, but the pooled overall knowledge was at 43%. Hence, education about HPV, cervical cancer, and associated prevention methods must be in place, and it's also good to integrate with sexual and reproductive health, antenatal health system in health facilities, universities, and various associations. A similar review by Perlman and his colleagues shows that the level of knowledge on cervical cancer and HPV were consistently low in sub-Saharan Africa. Similarly, a review by Cunningham and his colleagues stated that there is a broad knowledge gap concerning HPV and cervical cancer among African women. A low level of knowledge of cervical cancer among Indian women is also reported by Hisan et al. In contrast, overall good knowledge of cervical cancer was also reached as 76% in Saudi Arabia. Actually, this might be because of the difference in socio-economic status of the people of the Saudi Arabia and Ethiopia. So, in general, this study finding shows that there is a very poor knowledge of cervical cancer and other important variables of cervical cancer in Ethiopian context. So on top of this, certain articles had also reported about cervical cancer screening history of the study participant, and the pooled prevalence of previous screening history was at 43%, at 14%. So the poor knowledge about cervical cancer might link it with this poor screening uptake. It has been also reported that the knowledge of women on cervical cancer was a determinant factor for cervical cancer screening uptake. Further, the majority of women in this review had no formal education. So literacy was also reported to be an independently associated factor with cervical cancer screening uptake, as reported by Lundua. As a limitation, this systematic review, we believe that this review reported the latest summarized finding of knowledge of women on cervical cancer in Ethiopian context. However, our findings should be interpreted with caution due to some drawbacks. All the studies were reported from 4 major regions in the Addis Ababa City administration. So the absence of data from the rest of the country might bias the overall national estimate of cervical cancer knowledge in Ethiopian context. The other limitation of this review is the presence of high heterogeneity between the included articles. As a conclusion, the overall knowledge about cervical cancer was found to be poor in Ethiopia. That's about 43%. That needs an improvement as the disease is actually increasing on the other side. This study urges stakeholders' engagement in the battle, like the provision of organized education at various levels, from school to house, using different mainstream media and associations. Finally, I would like to acknowledge Bahada University, CDT Africa, and the Ethiopian Society of Obstetrics and Gynecology for the chance to present this study. Thank you very much.